I'm coming into the room to do a physical assessment head to toe on my patient. Hi, Mrs. Breland. My name is Shelby and I'm your nurse and I'm here to perform a physical assessment on you. Is that all right?
Yep.
Okay. Let me check your wristband. And can you tell me your name?
Madison Breland.
And your date of birth?
1/20/94.
Okay. And what brought you here to the hospital today?
Slipped on the ice and bumped my head.
Okay. Now I'm going to be looking over some of the things here. I've already, by asking a few questions, and I would have asked more questions, I would have already assessed her mental exam and I would have done a visual inspection, just like looking for her skin color, are her eyes moving, you know, the same way, and do some of that checks while I was visiting, you know, and orienting the patient. And now I'm going to go on and I'm going to get all of the past medical history, current medical history, medications. She's told me already that she has asthma, and I've asked her medications, as I said. I've asked if there's any herbal medicine that she takes, any supplements, any multivitamins, the frequency, the dosage, and I've gotten all that information from my patient. And then I'm going to come, I've already gotten the height and the weight, and I'm going to come and I'm going to do check your temperature. I'm going to do it tympanically. Okay. I'm going to also check her blood pressure, and probably before I do that I'm going to check her pulse, and I'm going to actually place her arm on her chest like this when I'm doing her pulse, and I'm going to check it for 30 seconds, and then after that I'm going to keep checking because I'm actually going to be checking for her respiratory rate without her knowing it. And I've got my watch position so I can see the chest rise and fall, and I'm still going to act like I'm checking her radial pulse. If the radial pulse isn't, if it's too fast or abnormal, then I'm going to go ahead and I'm going to take my stethoscope and I'm going to listen for her apical pulse. And that's at the midclavicular line and the 5th intercostal margin. So I'm going to be listening for her apical pulse for a full minute if her radial pulse is abnormal. Then I'm going to go on and I'm going to dim the lights in the room so I can do her neurological assessment. I've already asked a few orientation questions of the patient, and so I've already determined that she does know the date, the time, who's the president, all that kind of stuff. Then with the lights dimmed, I'm going to come up over here and I'm going to get my pen light on and I'm going to watch for constriction of the pupil. And then I'm going to do it again and watch for constriction of both pupils. I want to make sure that there's a consensual reaction. And then I'm going to come along to the other side, do it again, and I'm going to watch the other eye this time and watch for the reactions. I'm also going to come and check and say, can you watch, can you take this and can you watch, follow this pen with my eyes, or with your eyes. And I'm going to be watching for equal eye movements and, just assessing for head trauma, see if there's anything, going on that's wrong inside. I'm also going to, when I've done this, I'm going to kind of measure the pupil size so I can see, what the size is. That's another thing to tell if there's anything going on in the brain. I'm also going to come and I'm going to ask with my fingers crossed, I'm going to get her other hand out, can you grasp both my hands? Now grasp them as tight as you can. When I'm doing that, I'm going to measure, that's enough, thank you. Then I'm going to measure to make sure that both sides are equal and so that nothing else is going on with her neurological system. I'm also going to come down and I'm going to ask her, can you push with both your feet? Thank you. Now try to push my hands, bring your feet up and push my hands. Okay, and make sure you do both sides at the same time, and that will also tell you if there's any weakness or anything going on. Usually if there's weakness on one side, then it might indicate a problem on the other side of the brain. And now we're going to come to the heart assessment. And so the first thing that I'm going to do is I'm going to get my stethoscope ready here, and I'm actually not going to put these in because I can't talk and hear at the same time. But I'm going to assess her cardiac function, and I'm going to find the apical area again, and that's in the midclavicular line, 5th intercostal space. I'm going to be listening actually with the bell side because you can hear it better, and I'm going to have it on bare skin. I'm going to be listening for the S1 and S2 sounds. The S1 is the lub and the S2 is the dub, and actually the S1 is heard best over the mitral area. It's when the mitral is closing, and you'll hear it really loud at this spot. But the S2, you're going to hear it faint here, but you're going to hear it better over in the aortic area. So I'm going to listen there. I'm going to come up and I'm going to listen in the next spot. I think that's the tricuspid. I'm going to listen in the pulmonic, and then over in the aortic area. And that's it for my neurologic and my cardiac assessment.